So how do you fix a tongue tie? I live in the world of tongue ties and answering the question about how do you fix it. So a tongue tie or ankylosing is corrected or released in a procedure called a frenectomy, okay? Some doctors use laser, some doctors use scissors, some doctors use a scalpel, some doctors use stitches, some don't. It really, although it is called a surgical procedure, it's really pretty easy. I always tell kiddos that you go to the doctor. If you have a really cool tongue, the doctor is going to sign his name under your tongue. It's really, really an easier procedure, okay? I think the most important thing about fixing a tongue tie is making sure that you're working with a provider that mandates that you do myofunctional therapy, because when I work with clients who have not done myofunctional therapy before their release, the success of that is really slim. In my practice, I even go so far as saying that it's nearly 100% failure when I see clients who have not done the adequate myofunctional therapy. So it's kind of like getting a knee replacement and never doing the physical therapy. If you talk to anybody who's ever done that, they're going to tell you it's a bad idea. So that is how you fix a tongue tie. You have a frenectomy procedure done, and that releases that tissue underneath the tongue.